Good evening, everybody. I'm Star, like he said. And the first thing we're going to do is some housekeeping. I'm going to test you on that later, so make sure you take notes. Legal asked me to put that up there so that I let you know that some of what I'm saying is a forward statement. I can't see into the future, so I'm telling you the best I know with what I know now. Now that that's done, these are all numbers that you are familiar with because you're all in healthcare, right? 133 million Americans have been diagnosed with at least one chronic health care condition. That number is going to rise to 171 million by 2030. And why is that a problem? Because that $2 trillion healthcare problem that we hear so much about, 75% of that cost comes from that group of people. And the reason is because fragmented care is provided to individuals that have chronic conditions. And why is the care fragmented? Because the information is fragmented. You already know this. We're not going to spend a lot of time here. However many doctors you see, and let's not just talk about the doctors. Let's talk about naturopaths, chiropractors, acupuncture. Let's talk about all the pieces of health data about you that are floating around out there in the world that you have no access to. They're not all in one place, and your medical provider doesn't know how to access them to use them to help you. Here we come. Who are we? 4D Healthware. And what have we done? We're bringing that data into one place. Now that in itself is not game-changing. We're doing a couple of other things. We're making it gamified so that health becomes fun. We're also making sure that your doctor has access to this information so that he can see where you are, use it to help you, and tailor your care plans. You hear a lot about personalized medicine and big data. Big data is irrelevant. I need data that is applicable to you so that I can take that data and present it back to you, make suggestions to you that you can implement in your life in real time. For example, how many of you wear Fitbit, Nike Fit, Fuel Band, Jawbone Up? Come on, you guys are using these tools. Fitocracy, fitness apps. This is a room full of healthcare people. Okay, all right, you started to worry me a minute ago. So you're using all of these tools. We have built a device agnostic platform. And by the way, I'm using one too, so I have to get my steps in. So that's why you see me walking back and forth. So we built a platform that's bring your own device. We don't care what you use. You should be able to compete with your friends, regardless of what they have. We're also agnostic to all of the platforms that are out there in the health ecosystem today. So when you talk about doctors and clinics and hospitals investing in EHRs and EMRs, they're not going to change the system that they're using today. Everybody's heard of Epic. Epic is here to stay for now. And what we're going to do is plug in. You're going to tell Epic it's okay for us to access your applicable data, and we're going to use it so that it can benefit you. Pull it out of the system. Our analytic engine is going to go through that data much faster, much more efficient, and much better than any human ever could. Millions of pieces of data will come across that platform throughout the day, and suggestions will come back to you in real time that you can apply and improve your life. How are we doing this? Well, the first thing we did is we signed a deal with a clinic that has agreed to prescribe our platform to their patient population. Because a doctor is prescribing this to people who are obese or who are experiencing diabetes, needing help with managing a chronic illness, we are taking that information and providing a tool for everyone to manage their illnesses, and we're also providing a tool for the doctor's office to remotely monitor their patient population. It's about 4,000 patients. We're a subscription-based model, $9.99 per subscriber per month. So when you look at our partnerships, we have 6 partnerships with potential access to 23 million subscribers. Do the quick math, that's $2 billion. We know we can't do it alone. We need partnerships to make this happen, and those are some of the partnerships we have. I'm Star, that's my time. I'll be here all night. You can talk to me more about the company. Are there any questions?